According to Ministry of Health records, Uganda has so far registered 25,059 COVID-19 cases, out of which 1,565 are health workers. Yet of the 219 deaths, the sector accounts for 14. With the spike in COVID-19 cases, health facilities are reportedly overstretched already. Despite this glaring picture, Ugandans have continued to ignore the set standard operating procedures, leaving health service providers wondering and fearing for their lives.
COVID is chasing us out of our hole. That one is supposed to be here.
We begin improvising, and that's how we catch the disease, and then we die.
Through their different associations like Uganda Medical Association, health workers have advanced numerous demands that government should handle as soon as possible if the trend is to be contained. Top on the list, health workers are demanding for prompt payment of salaries, recruitment of more health workers to correlate with the increased demand for healthcare services, government to prioritize procurement and equitable supply of PPEs, even to those working in the private sector.
But also with the surging numbers, we urgently need more health workers recruited to man the hospitals.
Now we should be seeing recruitment taking place on a regular basis.
So we shall not sit back as civil society to allow the indifference of the stakeholders of this nation to affect our health workers.
Dr. Kwaro Buku, former president of Uganda Medical Association turned politician, blames the skyrocketing infections on the ongoing campaign rallies, challenging fellow politicians to refrain from open rallies since it only spiral loads infection rates.
Propose and challenge politicians instead of buying posters and anything else to maybe buy masks for the people. We can stop the rallies. It's not healthy.
According to experts, despite effort in swallowing yet scarce medical care treatment for COVID-19, the pandemic has numerous effects that one will have to grapple with, even after curing from it.
There are all these effects which come to us. Cardiovascular complications. People now get strokes.
It was here that Dr. Frank Asim of Mulago Hospital proposed for another lockdown, arguing that it's the only language Ugandans understand.
20th lockdown, open in January. We know Ugandans, we're going to hit the road and go to the village. Just lock us down.
Amidst all this, Center for Health, Human Rights and Development, a non-government organization championing the improvement of healthcare services across the country, has challenged Parliament to expedite the passing of the health insurance bill. According to Rose Wachikonai, Senior Programs Officer at SEHAD, time is ripe for Ugandans to get assurance of better and affordable health care.
We must ensure, government should ensure the protection and safety and security of all these healthcare workers.
Meanwhile, health workers have threatened not to pay the recently passed stamp duty tax, whose motive, according to them, is hinged on limiting service delivery in the sector.
We all know the economy is already so bad. Many persons can hardly pay the consultation fees.
Since the outbreak of COVID-19 pandemic, health service providers were segmented as top essential workers with an obvious aim of scaling up health care. Shaidati Nasaku, UBC.